Hi, I'm Leah Richter, and today I want to talk to you about trauma-informed care inside schools. I chose this topic because I want to be a social worker, probably working with children at risk, somewhere within, that could be anything like homeless children, um, foster care, adoption services, anything around those realms is what I'm interested in. So I thought that it would be really relevant for me to look into how I could eventually be treating the clients that I deal with as they're experiencing trauma, and especially be working alongside the schools and supporting them and informing them of trauma-informed care, one method that I've learned about as a treatment for these children so that they can do well in school. According to the National Child Traumatic Stress Network, trauma-informed care is something that should involve all people involved with the trauma that had been experienced because it's impacting them as well. So this includes awareness for those people, knowledge about what trauma is, and skills in which they can integrate inside their everyday lives when they're interacting with someone who has encountered trauma in their life. I found a really awesome study that looked into trauma-informed care from their own high school students' perspectives. So they used focus groups and gathered a group of 39 female students, 40% of who were African American, which matches the percentage that of African Americans that are in the foster system currently. And all these girls have dealt with some sort of abuse and neglect. This school specifically treats girls who have experienced trauma. And this focus group was aimed to understand some of the effects of the trauma that they've had and the different experiences and struggles that they've had in school. So it's really cool because we get to hear from the individuals themselves and empower these children to have a voice. So the girls displayed some correlations between trauma and poor self-regulation, struggle with social skills, struggling with impulse control, and externalizing behaviors. But not only did they shed some light on some of these correlations, but they also offered recommendations to their school of how they could deal with the girls better and treat their trauma better. So some of the main themes that were taken away from these focus groups was to provide a space that's welcoming and positive that the girls can come to, especially when maybe other places they don't feel as safe, and create a space where their triggers aren't going to be around them, so they don't have that fear and anxiety, and rather they can be focusing on learning and bettering themselves. So the school was not only able to implement some of these strategies, but I think that they really did a great job of treating the girls individually for the trauma that they have experienced. I think that further studies should look into more focus groups across the high schools of America to better understand, have a greater picture of how trauma has affected these children, especially within the school setting. A study conducted in 2015 found some similar results compared to the focus group that was conducted. They found that encouraging self-regulation should be implemented inside schools. A second recommendation was to build strong relationships. This will help with the disordered attachments that the girls might have from previous caregivers, and this can help them build those attachments stronger and help them in the long run. And then also a third focus would be just to add positive techniques into their education. So make sure that the environment is positive, that you're rewarding and encouraging your students in the classroom. So these past two studies have really shown us the importance of a great and strong and positive environment for the classroom, one free of fear and anxiety for these people who struggle with different triggers and from their impacts of trauma. And these are very specific techniques that can be applied to the education system. But as we look broadly, it's really important that trauma-informed care is implemented into not only the education system, but the systems that surround the child. So this could be anything from child after-school programs, sports clubs, basically anything where the child is going to be regularly. It's really important that trauma-informed care is implemented there too, because it's going to help their healing process and ultimately help them develop and grow as a human. The National Child Traumatic Stress Network has recommended 7 different aspects for a system to become trauma-informed. The first one is to routinely screen for trauma exposure and related symptoms. It's really important that the staff and the adults are being aware of what trauma symptoms look like. That way they can immediately address the trauma and its impact so that treatment can be administered. So that would look like a cluster of trauma-related symptoms that you're going to be looking out for. The second point is to use evidence-based, culturally responsive assessment and treatment for traumatic stress and associated mental health symptoms. It's really important that we are addressing the cultural, that the individual or the group of individuals who are experiencing traumatic effects, that we know their culture and that we're aware of how treatment interacts with their culture. There is a plethora of research depending on the culture and the treatment and assessment that you can look into. The third point is to make resources available to children, families, and providers on trauma exposure, its impact, and treatment. So it's really important that not only the children are being treated and aware of what trauma, its impact, and its treatment is, but everyone is involved is aware of what trauma is, its impact, and treatment. The fourth aspect is to engage in efforts to strengthen resilience and protective factors of children and families impacted by and vulnerable to trauma. So this could look like encouraging resilience in the system and really emphasizing protective factors and providing resources where you see a risk factor. The fifth point is to address parent and caregiver trauma and its impact on the family system. So it's important not only to treat the child in this situation, but also to understand and to inform the caregiver and the other people of the family of the impacts that trauma can have on the child, but also on the family system, and offer them services for treatment and other resources they might need. The sixth aspect is to emphasize continuity of care and collaboration across child service systems. So this kind of goes back to not only wanting trauma-informed care within the school systems, but also within other systems where children might be encountering or spending lots of time with the system also. And it's really important that there's communication across these systems. That way, staff members and educators can inform each other about the progress or maybe different struggles that the child may be experiencing. And lastly, it's important to maintain an environment of care for staff that addresses, minimizes, and treats secondary traumatic stress and that increases staff wellness. So it's really important that we're not only caring for the people who may experience trauma and its effects, but also we need to remember to care for the people who are treating and preventing traumatic stress. And we need to be encouraging self-care and staff wellness within that. Overall, we learned from 2 different studies, one in 2014 with the girls who had the focus group, and the other one was in 2015 where they identified specific themes of trauma-informed care within schools. They mostly focus on building strong relationships and having a positive environment where the girls can come anxiety and stress and fear-free, and they can fully hone in on learning and growing for themselves. It's really important that we're emphasizing self-regulation and characteristics like resiliency. And then it's really important to understand that trauma-informed care is a group of systems, not just within education. So it's important that we're communicating across different child services systems. Thank you.